Hey guys, my name's Dan. I'm a veterinarian, and you think your doggy may have kennel cough, but you're like, Dan, we get the vaccine every year, every 6 months. There is no way our dog has kennel cough. But we have these funny symptoms like we're gagging, or we gag, and then cough, and some sputum comes up. Or I'm thinking over and over to myself, did my dog swallow something? Did we ingest something? Is something stuck in my dog's throat? And also, I go to doggy daycare, so I think my dog may have something. Kennel cough is incredibly common. Incredibly. Like, no joke, guys. Over the last couple years at the clinic I work at in Nebraska, Omaha, Nebraska, I have seen so much kennel cough. And even if the dog's vaccinated, they can still get kennel cough if the exposure to kennel cough is heavy enough and big enough. Kennel cough, or Bordetella, bronchiseptica, or the whole collection of different bacteria in the upper airways, thoracic inlet and up, in the trachea, can definitely cause kennel cough. Now, kennel cough can be gotten, I should say, in any kennel situation or boarding or doggy daycare. That's the most common way. I do see dogs that roll in and have very little to no exposure to other dogs and still get the kennel cough. What is your veterinarian going to do? They're usually going to do a physical exam, get a temperature, pulse, respiration, listen to your dog's heart and lungs, and make sure that they're healthy besides the kennel cough. Once you make sure your dog's healthy, some veterinarians, if they're worried about anything, will do a chest x-ray to make sure there's no pneumonia or bronchitis if they hear something in the chest. Or if they're worried about your dog's overall health, they may do a CBC or some other lab work to make sure there's no white cell changes or any infection beyond the mild kennel cough in your dog's upper airways. Now, if your dog's like 2 and you went to doggy daycare and he's coughing, but he's eating, drinking, pooping, peeing, acting very normal, your veterinarian may run 0 tests because the physical exam is the only test they need. They may look your dog over, palpate the trachea gently, and on tracheal palpation, if your dog coughs and we get a honking sound, if you have video, guys, always get video of your dog. Your veterinarian relies heavily on your history, the physical, and the videos you take are a great history builder. So they will look at the history, and if they feel like your dog has kennel cough based on that, they may just treat. A lot of veterinarians, guys, are going to give doxycycline. It's an antibiotic. It's a great antibiotic for kennel cough. Sometimes they may give like Clavamox or Augmentin. That's fine too. That can work as well. But doxycycline is probably far away the most common antibiotic a veterinarian is going to pick for kennel cough. A lot of veterinarians too will give something for the cough as a cough suppressant. They may give like a steroid or something to reduce inflammation in the upper airways, kind of like croup. Kind of the same logic. Not always, but some of them will give a steroid or some other kind of cough suppressant to give you some peace and quiet so your doggy is not continually coughing and causing more and more turbulence and more inflammation in the upper airways. Your dog will usually get better quite quickly within a few days. Clinical resolution in a week or 2 depending on the severity. You should always keep your doggy away from other dogs because, guys, kennel cough spreads like wildfire. One dog coughs in another dog's face. Don't worry, my dog's vaccinated. Guess what? That dog is probably vaccinated too. Now, the vaccine definitely helps. It reduces kennel cough dramatically. Like if your dog is vaccinated and the exposure is minimal, they may be just totally fine. Or if your dog gets kennel cough, they may have a far less severe form of kennel cough because the vaccine did some work. But guys, I would say out of all the vaccines that I do, the kennel cough vaccine is probably the least effective because it's trying to prevent against an upper airway bacterial infection, which is incredibly hard to prevent against. So get the vaccine. It definitely helps, but don't expect it to be 100% in like lockdown like some of your other vaccines preventing against viruses. Hope this was crazy helpful. Guys, my name is Dan. I'm a veterinarian. I really appreciate you guys watching. If you could do me a favor and share this and subscribe, that would greatly help the station, the channel. You guys take care. Bye.